I think as palliative care providers in general, we understand that initiating dialysis in elderly patients with comorbidities is overall may not be helpful in terms of their quality of life. And we have a sense that it causes more morbidity and may even increase their risk of mortality. However, we don't know or may not be up to date as to the evidence behind comparative survival rates in patients with comorbidities, elderly patients with comorbidities who get initiated on dialysis. So the purpose of the talk was, number one, to review the evidence and what is the impact of initiating dialysis in the elderly with comorbidities. Number two, we also focused on the effects of functional status on initiating dialysis in the elderly, because we talk about functional status a lot when we are thinking about initiating chemotherapy in a patient with cancer. But with dialysis, it's not talked about to that degree. So we discussed what impact does initiating dialysis have on functional status. And the take-home points there were that in the elderly with comorbidities, that functional status declines fairly quickly after initiating dialysis. And then we talked about the challenges of advanced care planning and how there's a lack of advanced care planning in patients with dialysis and patients who start hemodialysis, even though the shared decision-making guidelines set forth by nephrology groups have made it clear that goals of care and having a full advanced directive discussion. One of the take-home points after looking at multiple studies was that elderly patients, especially after they have 75 or 80 with comorbidities, especially ischemic heart disease, you saw less of a survival benefit in that age group with comorbidities than of course, younger patients who initiate dialysis. And then lastly, we talked about the need to improving knowledge for ourselves, first and foremost, but also having this opportunity to improve training for our fellows, especially nephrology fellows who in recent studies said they want to have more palliative care training, and really ensuring that our colleagues that we work with have primary palliative care skills and can have these conversations on the risks and benefits of initiating dialysis in a very vulnerable patient population.